first, I would like to ask for your permission, both of you, to use this video for educational purpose and on internet.
Yes.
So, what do you do for a living?
We have a hardware store and I farm.
Okay.
Livestock.
Livestock. So tell me, before our surgery, what were your symptoms? How was your life? This question is for both of you.
Bad back, sore legs,
Pain.
a lot of pain.
A lot of pain. 1 to 10. How bad was the pain? 10 being the worst pain.
7 to 8 before.
Yeah.
And taking care of him and trying to get him relief, 12 to 15.
Oh wow, 12 to 15. And yes, he's being generous.
Yes. He says everything's great, but when
Yeah.
he's at home, it's a different
It was
story.
different, yeah. And then, how long did you have those symptoms before the surgery?
About 2 years.
2 years.
Yeah, because this is
But
your
you
second
did surgery on me
surgery.
before,
Yeah.
2 years ago.
That was a microdiscectomy. We did a microdiscectomy, and
Yeah,
we sort of took the pressure off. But then
Yeah.
we noticed that
it helped, but
yeah.
only for about a year.
Yeah.
And you said when you did that last surgery, we're not done. You have to have a major
Yeah.
one.
Well, in that first surgery, we took the pressure off the nerve. We just literally trimmed the disc, but that disc was beyond help. And then we noticed that those discs, actually, many of your discs are in a bad shape, and your spine was side bending. So, and that, in the long run, ended up, pushing on your bones and nerves, and so you had severe symptoms. So we did the surgery in January, correct? About 5
30th.
months, about actually 4 to 5 months ago. Now you stayed in the hospital 2 days, 2 nights,
Yeah,
correct?
2 nights.
2 nights. And how was the first 2 days, and how was the third and the fourth day? Tell me about that.
The first night was unbearable.
Yeah,
Unbearable.
was bad.
And you kept coming. You were in a couple of times, maybe midnight, to check on me
Mm-hmm.
because you know how bad I was hurting. And then the next day was not so great, but I was up walking stairways,
Mm-hmm.
and the nurses told me, you got to slow down. You're walking too fast.
Yeah,
You're going up and down the stairs. She said, slow down. It's not a hurry.
yeah.
And I walked home. When we drove home, I walked in the house, and everything's been good since.
Yeah, but so you already by the third day you start getting better. So
Yeah, third
Yeah.
day I was way better.
okay, so and you told me as well that you went back to work how many days or weeks after the surgery?
2 weeks, about 2 weeks.
Almost 3.
3 weeks after a
After
surgery
surgery.
that I'm going to show you what it is. We did a scoliosis surgery. We did actually 3-level fusion, and we decided to do a segmental correction. You have a spondylolisthesis, meaning bone falling forward. Your spine is side bending, which is corrected now, most of it. So we put 8 screws, 2 rods here, and 3 spacers. This is usually would have been a 8-hour surgery, open old-fashioned way, but we did that surgery literally in 1.5 hours, and you were still walking. First night after this kind of surgery, this amount of correction certainly is painful. Expecting this not to be painful, this kind of surgery is unrealistic, but already we're getting better after 3 days. Now, how is the leg pain that you had before the surgery? Is
Gone.
That's gone.
Gone.
When did that leg pain go?
Pretty much immediately.
Immediately.
He had sensations that would go from one leg to the other,
Yeah.
but they tapered off
So
within,
it's better.
I would say, a
Days.
month,
Days.
where he didn't notice it. And
Yeah.
then he thought his back felt numb,
Hmm.
like he couldn't feel the skin.
It's still
Yeah,
that
yeah.
way though. I can
Yeah.
still. The
Because
skin
you
is,
put lots of small holes there to
Yeah,
put those screws
I
in.
can still feel my back. It doesn't hurt. It just feels different.
Yeah.
The skin feels different.
But you, even with your demanding job, and you told me that you think he's overdoing it. What is
I
he
know
doing?
he is. He carried way more weight.
Uh-huh.
We went through calving, and we had the calving season from hell with weather and
Storming
complications.
and cold.
Every
So,
dumb cow had
You didn't go
twins
to a
and-
desk job 3 weeks after the
No.
surgery. You went to that kind of job after 3
Yeah.
weeks after this kind of surgery.
Right.
That is unheard of. To after open surgery for somebody to be able even thinking about that, that is absolutely unheard of. And you sitting there, yes, you have some symptoms, but it seems that overall you are going the right direction and you are able to pick up your life. Now, you told me a story about another person that had the same kind of surgery, open old-fashioned way. around the same time. Can you tell me that story?
11-inch incision she had in her back,
Mm-hmm.
and it hasn't been good. And it was it was draining or something. They had to put a
They
tube
put a
in it.
drain in.
Put a drain in it
Yeah.
to drain.
After open surgery, we always put a drain in to get the material out that accumulates there because
had
it caused
that
too much
as well.
damage. No, you didn't need a.
No, I have no drain.
You didn't need
Nothing.
the drain. Yeah, but how is she doing? She got the same surgery almost around the same time, and it's now 5,
2 weeks
6 months.
before mine.
2 weeks before you even. Okay, so but she's still not there where she needs to be.
No, she's having 2 stents put in her legs
Hmm.
for
Because
some
she, yeah,
circulation or something.
yeah, because she hasn't been able to
She
freely
can't walk.
walk. She
Right.
can't walk. Yeah,
Walker, she walks with a walker.
Yeah.
Right? And now 2 weeks ago, she walked with a walker.
yeah. So you are a proof that, it's the advantage of doing it this way versus the
Oh, very much.
old-fashioned
I
way.
would recommend to anybody.
Yes, yes, thank you. And this is exactly what I'm going to show to my colleagues to see what the actual difference is in patient's life, what we do. Okay? So,
You
well,
operated on a guy back in September
mhm.
in Alexandria. He comes in, I just saw him yesterday. I told him I was coming to see you today. And he says that's the only way to go.
Okay.
He's doing excellent.
Excellent. Well, so thank you so much. I really appreciate the interview.